Okay, so let's go ahead and get started. And first of all, I want to thank all of you for being here today. And the topic for today's discussion is 6 ways to reduce the impact of the COVID pandemic. And we're going to be giving you the latest and greatest from a lot of different sources, credible sources that we've been able to identify. And we're going to be sharing some facts and figures and trends and challenges through today's discussion related to the pandemic. And so let's go ahead and get started. If you're just joining us, here's some general housekeeping items. All participants will be muted. Actually, you'll be on listen-only mode. And this is to ensure the best audio quality throughout the entire session. And there's no background noise at all. If you encounter any audio issues, you can actually refresh your browser. Also, you can check your audio settings on either your computer or laptop. And you can also feel free to submit your questions using the Q&A window, or you can use the chat window. Either or will be fine. Philip and myself will be monitoring both throughout the session. And then we can actually account for some questions and answers during the session, but we also have a Q&A portion at the end of today's discussion. And we're recording today's entire session, so we'll be making that available. We'll be sharing a link with you after tonight's discussion. So let's go ahead and get started. First of all, I want to give a special thanks to Make Offices. They're usually our event hosts because they actually provide us facilities where we usually meet physically. As we are doing using Zoom, and we'll be using Zoom moving forward as long as we are in the current new normal that we're in right now. Beyond actually is providing us the Zoom webinar platform, and it's accessible to us, and we can actually accommodate up to 100 people attending at the same time. So actually it's a great way to meet virtually, and I want to give a shout out and thanks to Beyond for allowing us to use their Zoom webinar platform for allowing us to meet. As long as we're continuing to meet virtually, we're going to be doing this at least for the next couple of months. Bolt PM, that's my company, and also Intelligentsia, that's Philip's company. And both Philip and I will be panelists today and basically talking and just kind of walking through some of the experiences that we have had in keeping track of information and also misinformation regarding the COVID-19 pandemic. So going back to today's topic, last month, one of our sponsors actually presented virtually, and we still met physically, but they were actually attending virtually, and that is because the company is located in suburban New Jersey, just outside of New York City, and they were one of the early adopters of social distancing, and they've pretty quickly, at the beginning of last month, allowed all their workers to telework, and our presenters were actually virtual last time, even though we had a physical meetup. So for us, we've been able to do this, and we're glad to be able to have this extension because it's actually a great way to continue to engage and actually talk about things that matter. So today's topic will be focusing on answering this particular question. What is the best approach to mitigate the impact of the COVID-19 pandemic? We'll be talking about some of the things that experts are saying. We'll be looking at the human impact to this pandemic, but we'll also be looking at what experts are saying is the economic impact. And in many cases, the economic impact is actually much greater than the human impact. And that is what's causing a lot of debates with this. So we'll be talking about specifically why is it that we're doing what we're doing in the US, and why is every country taking a slightly different approach, and maybe benchmarking and comparing results between one country and another, as this pandemic has begun in China and now has spread in multiple countries around the world. So we're going to talk about facts and figures, visualizations and demos. We're going to talk about 6 actions each country should take, and that includes the US. But we're also going to be sharing, if you're a business owner or a small business owner, we're going to be talking about the impact to mid-market companies and small businesses. 7 ways that your business can not just survive, but actually persevere and then thrive once recovery begins. So let's go ahead and get started. And actually, the first thing I want to do is I want to be able to introduce myself because I sort of forgot to do that. I kind of assumed that everybody knows me, but my name is Hector Del Castillo, Chief Product Officer at Bolt PM, and I'm also operating Beyond, and we're going to be sharing some of the information from Beyond. Basically, Beyond focuses on providing and servicing business owners that need help in figuring out how to scale their business and how to make their business thrive regardless of economic conditions. So we'll be discussing some of that information as we're discussing this. So let's talk about facts and figures. And before we get started, actually, I want you guys to get engaged. Tell me, either using the Q&A window or the chat window, your response to this question. How have you been impacted by the COVID-19 pandemic? And you can type in any answer you want, but here's some available choices. You can tell me you haven't been impacted at all, it's business as usual for you. You're now teleworking 100%. You're unemployed. You're now underemployed, or you're completely overwhelmed with work. Which one of these are you in? If you can type in on the chat window, let me know which one of these applies to you. And I see one of you has saying you're overwhelmed with work. Well, that's good. What has been your experience, Philip? Which is your answer to this? How have you been impacted in your business?
Well, sure. I was actually typing something out. So far, we're lucky that we're not impacted on the business side yet. Our clients, both federal and private, is business as usual. In fact, we're just teleworking more. Mm-hmm. The one thing I did notice this week, though, is because you and I have had a couple in-depth conversations, but really trying to find out the truth. There's a wide gamut of information, right, all the way from over here to over there. Mm-hmm. A lot of misinformation, false information, or as people learn more, new information. Mm-hmm. And I found it became really, honestly, very stressful for me. There was one day that I really didn't get anything done. I just felt overwhelmed because I was so immersed in this data. That was actually something that was shocking. I had to take a day and just say, I'm not even bothering with this stuff anymore.
Yep. And I see that many of you have responded. Some of you are saying unemployed. Many of you are saying no impact, business as usual. And a few of you that have already been either dislocated or currently unemployed. And this is the range of things. And I think that's really the perspective of the country, right? We're not necessarily a big group right now, but I think the perspective is that if you talk to people around you, even whether they're here or somewhere else in the country, it's a gamut of things, right? There are some people that have had no impact, others that are now teleworking when they didn't have much teleworking before. They're now teleworking the majority of the time, or at least part of the time. And many are unemployed, and often people that are underemployed are looking for figuring out how to get into. And a few of you are overwhelmed with work. And this is the truth when you're talking to, let's say, specifically to healthcare providers that are now running hospitals, right? But beyond that, there's other sectors that are overwhelmed with work. And we're going to be talking about, what this entire range of perspectives are. Because as you talk to people that have no impact or who are overwhelmed with work, you're getting different perspectives. And then we're going to try to put that together because we really need to have at least some clarity as to what is the best way to move forward as a country to get out of this current situation as fast as possible and minimize economic impact. So there's 5 charts that came out and they were published earlier this week, actually just March 30th, I believe was the date of publication on Nature. Nature magazine has their website, and they actually put an article that has these 5 charts that we're going to talk about. And they're talking about, first of all, hey, this is our 5 things that are most important about coronavirus pandemic, right? Number 1, the rapid spread. And just last week, US became the country where the majority of confirmed cases have surpassed every other country, even China. That has been a major inflection point because we're still right now, if you look at what's happening on both coasts, East Coast, West Coast, everybody is on lockdown mode because that's where everything started, right? Ground zero for us was up in Seattle, Washington. Then it quickly followed with New York and basically came from both sides of the country. And we're going to talk about why that is, but then it's now starting to spread. And then it's all really the rural areas right now with this kind of a lot of mixed emotion because people are saying, what's the big deal about this little virus? Well, here's what it is. Here's another same magazine published, how deadly and how contagious COVID-19 compared to other infectious diseases that we've seen in the last 100 years or so, right? Ebola is very high. And while Ebola is 50% of people who catch Ebola die from Ebola. That's reality. There's no vaccine. There's no cure. There's therapeutics. And the best you can do is catch it early to increase survivability. But that's really the deadliest disease that we've known so far. Now, the good news is that it really doesn't spread that much because you're only infectious for a few days. And other than that, you can have Ebola and not be critically ill, and you're not infectious. MERS, similar things. You can be infectious, it's deadly, but we were able to treat it, and now we have not just therapeutics, but vaccines as well, and the ability to test very quickly to ensure to be able to detect. TB has been around for such a long time. It's already almost been a few times trying to be eradicated. It hasn't been eradicated. Right now, what's happening is there's TB that has become more resistant to current drugs, and it keeps on evolving. So tuberculosis, even though it seems like it's been around and what's a big deal, it's now becoming more and more drug resistant as it evolves. And SARS is also the same thing, right? It has a mortality rate of 10%. Fairly high compared to other types of flu, seasonal flu, and even H1N1. But also, you're not contagious. A person is not contagious for very long, and usually you can tell when they are infected, so you can stay away from them, right? What makes COVID-19 so different? A couple of different things. First of all, it's infectious, it's contagious, right? It's got an R0 that is higher than the seasonal flu, higher than H1N1, lower than SARS. The difference is, a major difference of COVID-19 is that people can be infected and not be showing any symptoms. And that means that if I'm in front of you and I'm infected or you're infected, I wouldn't know. And if I just, socialize with you as a business as usual, I may be infected and I may have a completely different reaction than you do. And you can't tell. This is what makes COVID-19 so radically different from any flu, including the H1N1 or even SARS. Because SARS, they all have behaviors where you already have symptoms and you can tell when people are infected, except for COVID-19. Feel free to chime in if you have anything to chime in, okay, Philip?
Absolutely.
Moving on, is it lack of information or too much information? This is something that Philip and I were talking at the beginning as we started, is the amount of information about coronavirus right now, it is overwhelming. So overwhelming, in fact, that you can't really, it takes a lot of work to figure out what is credible information versus what is misinformation. And there's a lot of both. This talks about credible information. This particular article talks about credible information that is out there and says, yes, it's much more than previous. This is all the journals that have been printed in the orange since we learned about it at the beginning of the year. And then in blue is all future publication articles that haven't been published in US yet. I don't believe this includes misinformation because they're only tracking credible information on this particular statistic. But my guess, and I don't know, Philip, I don't know if you have a different view, but my guess is that right now there's just as much misinformation, if not a little bit more misinformation, than credible information. What is your take on this, Philip?
Yeah, I definitely agree. A lot more uncredible. A lot of people's opinions,
Mm-hmm.
and sometimes opinions stated as facts.
Mm-hmm.
And I think that's actually, even more dangerous.
Yes.
So I guess quick example, there's some of it that's a little bit subject to personal opinion, but you look at initial official reports saying, hey, it seems like young people don't get this. And so all the young people went to the beach.
Yep. Spring break.
Yep, exactly. And it was wrong, right? Now it turns out they do get it.
Yep. Yep. So
I
here's
I used to be young.
Yeah. And here's the positive impact, right? Cleaner air everywhere, right? As we have gotten into a total shutdown, it's become evident if you do time lapse and satellite imaging, how metro areas that usually have a high density of NO2 is now becoming cleaner because there's less industry, less people traveling to and from on a daily basis, and that equates to a cleaner much higher air quality, even in metropolitan areas. So what we're seeing here is a map of Beijing at the beginning of the year when they were when they were actually in as they were just getting started with the lockdown, and in February the lockdown and basically shows a lot less NO2 in the air for the same area. If you were to look at the DMV area or even San Francisco, any of the major metropolitan areas in US, you probably will see this if you look at satellite imagery of the same thing. And this kind of information can be made available or be seen off of the NOAA website, because that's who tracks air quality here in the US, and also the temperature of the water. Now, coronavirus timeline. Look at what happened. This is actually superimposed timelines as to the world's reaction to SARS, to the reaction to COVID-19. SARS became a pandemic, but there was not much impact in US because does anybody know when SARS occurred in US? Anybody can guess? Can
2003?
Type in? Yeah, around in the early 2000s, right?
Yeah.
So if SARS is more deadly and more infectious, more contagious than COVID, according to the chart, why was it not a big deal back in 2003 compared to COVID-19? And what this is showing is we actually were faster as at the world, that once the first instance was reported, even if you can argue it was delayed reporting by China where it started occurring, why, even though we started moving faster, why are we in the current situation that we're in? This kind of things that we're going to be saying, because we're saying that we actually were faster to react. Everybody from the World Health Organization to having transparency once it was admitted that this was a new type of virus that they were reporting, and then people were tracking, and now they had all countries were at least warned that this could have a potential impact of becoming the next pandemic. So why are we in the mess that we're in right now? Because when was the last time that you recall in your lifetime that we were in this type of mode here in the US? What about you, Philip? What is your take? Can you recall of a time when we have ever been like this as a country for anything?
This is before my time. I was going to say the last time we saw this, I think I was mentioning to you earlier, was the Patrick Swayze's Red Dawn.
Exactly. Yeah, movies, science fiction, right? Science fiction movies, not real life. So this is things like, are we like now living our science fiction? Are we now in Westworld kind of thing? Let me ask the question, and I guess I want you guys to answer either using the chat window. Take a guess as to the number of pandemics that we have seen around the world, not just US, but around the world, because by definition, a pandemic is a global outbreak of an infectious disease. If you can take your guess, you can either use the Q&A window or the chat window to answer this question. How many pandemics have there been around the world since the beginning of the 20th century? So basically the beginning of in the 1900s all the way up to now. How many pandemics would you guess have there been of different shapes and sizes? It may be any kind of infectious disease, whether it's caused by a virus or bacteria, even as the bacteria is now more drug resistant. What are the pandemics of the 20th century up to present? It's actually nine different pandemics since 1900 all the way up to today, including COVID-19. Now, if you don't believe that, this information is available, and there's information available from a organization that is actually it's called the Visual Capitalist, and they published this infographic that's available on their website. We're going to be sending you the link where you can actually view this information, but there's also this video available from YouTube, which is really cool, and I want to play this. And before we get started, which country do you believe is better prepared to deal with a pandemic? We're talking about all the modern countries, Western and even third world countries. Which country do you believe is most prepared to deal with a pandemic? Use the chat window or the Q&A window to answer and take a guess, and then we can actually give you the answer. So one of you is saying Japan, another one saying South Korea, another one saying Iceland. Well, Iceland, that would be nice. I would like to move to Iceland at some point.
Yeah, I guess actually Antarctica is pretty prepared too.
Yeah, exactly. And one of you saying at least that those countries that are most recently suffer from a pandemic are the ones that are prepared. So for example, South Korea, pretty good guess. All right, let's take what the answer is. According to the Global Health Security Index, and that is a nonprofit organization, you can look it up. Here's what they published last year, and this information was published by the Visual Capitalist. It is available from their website based on data that was collected, because there's an organization that has measured this, I think, for the last few years. I don't know how long they've been around, but this is the latest data. And it shows that the country that is most prepared is the one that is at the very top. And which country is at the very top? US at 83.5%. I don't know if you can see the number, but it's just underneath 85%. Out of all the civilized countries in the world, US ranks number one, the highest at 83.5%. Look where China is at. China as a country is right below at 48.2%. I don't know if you can see the number, but that the information, you can blow it up. You can actually see that information as an infographic. It's just hard to show on a single view graph, but it shows that US is number one, where China is. And does anybody can make up the flag for South Korea and where they're at? If you guys are good at recognizing flags, I would guess they're somewhere over here, but don't recognize that. If you can see it, let me know. Use the chat window to let me know where, if you see the Korean flag somewhere.
I mean, North Korea is at the bottom, but you're asking about South.
Correct. So Dan is asking, what is involved in this score? Who's doing the scoring and what's involved in doing the scoring? That's a great question. And you should go to the website because they actually define the guidelines for doing this. But I'm saying, wow, of all the most prepared countries, we rank number 1. And yet we're having this particular debate as to what are we doing and why. And if you look at the numbers, I don't know that this actually is real, because being ranked the highest means that above everybody else, we should be leading the world in how we deal with this pandemic. And instead, last week, we became the country that has the highest number of confirmed cases, even compared to China, where China has 3.5 times our population, and they had less confirmed cases over time. Now that they have it under control, they're now back into manageable numbers, not exponentially growing numbers like we are right now. And we already have topped everybody else. We're leading the world in number of confirmed cases. And it's shown that we have done a terrible job as a country at flattening the curve for US. So the mortality, the death toll here in US is going to be probably above anybody else, including Italy, is what this might say. So I have a question. Who graded this and how did we rank so high, highest in the world, and we're doing so terrible in the implementation and response to this pandemic? So let's move on to the next one. Here's McKinsey just published this earlier this last week at the end of over the weekend, actually, on the 26th. They actually published this report, and we're going to draw on this. We're actually going to put this on hold because Philip is going to demo a portal that basically starts validating this information, and we're going to give you a lot of information that McKinsey just published. There's a lot of really good, useful information as to why are they forecasting the type of economic impact for U.S. because they've done this. They've done a calculation of real GDP economic impact for the U.S., but also the rest of the world. And we can actually take a look at that. But it shows that one of the things that's to where we are lagging compared to any other country is in the number of available test kits to detect whether you're infected with COVID-19, with the virus that causes COVID-19, even though you're not showing any symptoms. And that is key, because if you don't know, you need to do everything that we're doing right now: social, physical distance, washing our hands constantly, and everything else. And on top of that, wearing personal protection equipment, where there's a huge shortage of everything that is personal protection equipment, even if we are not healthcare workers. And all of that means that we need to not only have physical distance, but we also need to do a lot of teleworking if we're going to stay employed. And is that reality for all sectors of companies that are in US? Right now, we're behind in testing, and we have the most number of confirmed cases compared to any other country in the world, including China. So we're going to talk about also how this is rising. Here in the blue, that's US. Everybody else has a flatter, not as steep. We are rising faster than any other country. And 2 weeks ago, we have the most number of confirmed cases. And this is all numbers as of March 26th. We're going to confirm these numbers when Philip demos his portal. Here's what happened in South Korea. One of you answered South Korea is very prepared. Well, here's the proof. South Korea was able to successfully, from the beginning of February all the way up to March 20th, they were able to flatten the curve effectively. And now, at least, yes, there's new cases, but they're not growing exponentially. They're growing linearly, not exponentially. And that is controlling and having the right response to a pandemic. So South Korea is doing it right. What are they doing? Because we could be doing the same things, and somehow we're kind of missing those lessons learned. China, here's China. Yes, they actually were able. They could not flatten their curve, but they did bring it into control because here the inflection point. This is where it was growing. It peaked here, and now slowly it's been coming down. They had a spike, but then they quickly brought it down, and now they're just keeping it at manageable numbers. Yes, there have been some new confirmed cases even in the last couple of weeks, but they're manageable numbers, right? They're not overwhelming compared to the population. And we'll talk about, how population, the size, the relative performance. So China is doing it right. And remember, where were they in the score? Where were South Korea and China in that index that we were showing earlier? They were not ranked. They were ranked
China
much lower than US. Go ahead.
It was about 50%, right?
Yes.
One question I have here, though, is when they had the spike in February and they quickly brought it down, or did they quickly stop reporting their numbers?
Good question, but I don't think that they would be going back to work unless they already know that they are back into control. So at least maybe they're doing daily monitoring. I don't know, but that means you got to test and test and test continuously to ensure that as soon as you see confirmed cases, you quickly isolate those people from the rest of the population. And that's what's happening here now in steady state for China. So yes, there's still going on cases, but before they get out of control into, back into exponential growth, in order to get this kind of results, that you have to statistically sample the population in all the regions where it happened, and even sample regions where it hasn't happened, because now you get people traveling from one province to another. You don't want it to spread in provinces that didn't have any crisis at all. And China has a lot of territory to cover, right? So this means you have to continuously test to ensure that you isolate very quickly before those people spread it very quickly to 3 other people. Because you get that geometric progression as you infect people when you're asymptomatic. So let's move on to the next one. Here's a video. So this is actually the World Economic Forum that actually published this, and actually it's on their website as well. And we can share the links to that information. All of this, it's hard to see. I want to ask a question before I proceed any further. What do you think is the economic impact, and how does it make you feel? Those of you that actually are overwhelmed with work right now and are not necessarily healthcare workers, and those of you who are still now teleworking, how safe does it make you feel to see this type of pictures when you're watching television primetime? Because it's been all over primetime, whether it's free television or streaming services or even cable services. And today we have 0 sports in US. How does it make you feel? Just type in your answer. Does it make you feel like you want to go back to your office, knowing that right now we can't even detect who's infected and who may be spreading it? And maybe good for them, they're okay, but not necessarily for us or our family and friends that we're socializing with, as we may be carrying it as well. How does it make you feel? Are you doing it for yourselves? Are you doing it for people you care about? And that's kind of a rhetorical question because I know how I would feel, and I can share very openly. I do not want to be the cause for getting my parents infected, or if I had anybody else that is a high risk population. I just don't want to be doing it because I could be infected with no symptoms. I don't want to be the cause of anybody's death personally, whether it's a coworker or whether it's a family member or friends. What about you, Philip? What is your feeling? If you were asymptomatic and it's not a big deal to you, it's not a big deal for, who do you care about the most that could be at risk?
Differs from a lot of people. I do like the way China, or I keep saying China, I like the way Japan handles it the most, where they really treat it like, and I know you're not supposed to say flu, but they do treat it like a serious flu, where everyone who could teleworks. They're keeping their distance. They wear face masks out of respect, not just for COVID-19, but generally speaking, their face mask culture. They bow in greeting instead of kissing or handshakes.
Mm-hmm.
And I've discussed with a few people that, to me, number one, this is a people problem, right? When something serious happens, instead of everyone doing their part because I really believe if people would just social distance, work from home when you can, minimize contact, we could flatten the curve that way.
Mm-hmm.
So many people refuse to do that.
Mm-hmm.
Now we need stricter measures just because of those few people who really ruined it for everybody else.
Right. Yeah. And even if you try to ignore it and say, hey, I don't watch TV and, I'm there with you. But what about when you go to the grocery store? Or what about when you try to go to a restaurant and now, it's not even open. You can only drive through or carry out or, get it delivered. Those are all things that you want to start looking at, why are we doing this? Because I know the answers for myself. And sometimes you need to kind of make sure that it may not necessarily be impacting you financially or even, in the range where you may be impacted. But the risk is that you could be carrying it, not knowing it, and then infecting those that you care about the most. And I know what my answer is, and that is stay at home and telework. And even maybe painful, but basically keep that physical distance as I interact with people. And they're saying nowadays that even as you go out, you've got to wear a mask whether you think you're infected or not, because it will just be the best, safest approach when you're getting close to anyone. And these are all things that,
it is a bit laggy, so sorry if I'm jumping at the wrong point. This morning, even before I left the house, I had a guy, he didn't look like he was from an official company, knocked on my door and wanted to do landscaping.
Mm-hmm.
He kind of had an old pickup truck, a beat up trailer on the back of it. And, he's like, hey, I have a tree that everybody knocks on my door about once a week. They want to cut it down. I'm like, quit bothering me about my tree. But I told him, look, I am considering doing the most I was going to do with my kids, and, he's trying to drum up work. People are shutting the door in his face because, scared of everybody, but, he still needs to eat and he doesn't have the luxury of working from home.
Right.
So I really feel for, and I'm sure other people do too, but I feel for people who are trying to figure out how to make money when they can't work from home.
Yep. Yeah, and it's almost like you have to have a completely different way of marketing your business when when it's a people business, right? You have to be in front of people because that's what you do, and that could be any kind of service provider industry, whether it's somebody who's going to fix your car, somebody who's going to fix your AC at home. All of those people are the ones that are impacted because now they're going to have to figure out how to not only protect themselves, but at least figure out how to actually get more business, because right now, that's the last thing in our mind. We're right now, overwhelmed with work at home, right? At the worst scenario. And then you're feeling that you're getting interrupted when somebody comes in and knocks at your door asking you, hey, can I do this for you? And you're just like, no, I didn't ask you for that.
No, you're absolutely right. Yeah. And on the flip side, I'm like, I got to make sure my money's right. I got to make sure that I'm not overspending, but at the same time, I want to do what I can, to help guys like that are out there trying to work.
Yep. So here's the thing about this is also from the McKinsey, the same McKinsey report I spoke about earlier. And this talks about that curve that basically is about confirmed cases. That's that white curve that has the, we're right here on growth right now in the US. And knowing what is the healthcare capacity, here's the point. I want to ask a question. How many people do we have in US? If you guys can kind of chime in, just tell me, what is the total population in US today? Around a little bit over 300 million people is what we have today, right? We're going to show those actual numbers, because now my next question is, how many ICU rooms across all hospitals in US do we have in US today? Take a guess. We have 300 million plus people here in US. How many ICU rooms for those that get critically ill, even if it's a small percentage out of everybody who gets infected, out of the 300 plus million that we have? Actually, total number of ICU rooms across all hospitals in US today, only 224,000 rooms, ICU rooms across all hospitals. How many hospitals total in US? Right around 5,000 total. That includes all US hospitals. Amazing, because who would have known? We have 300 plus people, and for the most part, because we're in a very good economy and we have access to healthcare for the most part, who needs ICU, right? It's not a everyday thing. And yet, what is the number, the percentage of anyone that's infected that ends up being critically ill from COVID, from the virus that causes COVID-19? Can anybody tell me what that percentage is? It's around 3%, 3 to 4%, somewhere between 3 to 4%, depending on the epidemiologist that you interview. They will tell you between 3 and 4% of anyone that's infected with the virus that causes COVID-19 ends up being critically ill and then needs access to an ICU room and access to a ventilator. And that is the capacity. That's right now. You can't automatically bring up new facilities. And that's what China had to do, as a matter of fact. They actually built entire, 100 plus, several hundred room hospital just filled with ICU rooms that had enough ventilators. That's what they had to do to be able to flatten that exponential growth they got, even as they were unprepared. And we're seeing some of that here, but just not enough, because if you run the math, what is 3% of even 100 million? If that's who gets infected, a third of the population gets infected with the virus. And what is 3% of that 100 million? It's 3 million people. We don't have enough capacity, and trying to get to that capacity is impossible. This is why we need to focus on flattening the curve. And what McKinsey is saying is, the more time that it takes, the greater the impact to our economy. And it already is at a minimum 8% of our real GDP for US, and likely to go as high as negative 13% loss in real GDP for US, based on what they're seeing right now, all the economic indicators. Which one of these is more likely to happen based on this scenario? Is this like science fiction, like not real? I want you guys to tell me, of these three possible scenarios, a quick recovery, meaning we don't quite get into a recession, because recession by definition is 2 quarters of negative GDP before we're actually, in a what everybody is universally understands is the definition of a recession. That's a quick recovery, means that we go down from maybe 1 quarter and then return in the next quarter or two back to where we were at the beginning of the year. That's a quick recovery. Or we go into an economic recession, meaning we get to something like similar to what we had in the Great Recession back in 2007, where we did go into a recession because we had a negative GDP for 2 quarters in a row, and then it took us about 12 months to get back to where we were at after, right? That's an economic recession. Or is it a global recession? And a global recession means that it's actually going to be a much deeper recession than the one we just had in 2007. just give me a guess of which one of the three you think we're most likely today, that the best outcome is to be between one of these, two, maybe two of these three. Which ones do you believe you're at? Do you believe the McKinsey numbers? Because this is for US specifically. And many of you are saying we're likely to see a global recession. Let's look at the numbers and we can actually test that, right? Here's what a current article that was published just at this week is saying, that a likely scenario, what everybody wants, including everybody that's currently in the current administration, says they want a quick recovery. Well, that's nice wishful thinking, right? Because what McKinsey is saying is we're already here, and worst case scenario, we're going to be here. And a global recession means where we began, which was roughly around 3% growth rate at the beginning of the year, we're going to take a dip and we don't come back until later. And the growth rate, the new growth rate, is going to be much lower than it was at the beginning of the year. And for those people, they're trying to avoid, because this is like their worst case scenario. And we're going to talk about this because there's ripple effects throughout the economy. So does anybody know when I say GDP, what does that mean? It stands for gross domestic product. And there's a video that explains that. I'm not necessarily going to be playing that, but there's a video that explains that. And you can actually view it because we're actually going to make that available to you. It's actually from CNBC. They have explainer videos on what is about the economic factors. So GDP, just roughly speaking, 4 different major things that most people are tracking on an ongoing basis, country by country, right? Consumer spending, that includes consumer confidence, government spending, capital investment. These are all, companies, but also private equity and financial organizations that are investing back into the country to, go into to continue the economic growth of the country. And then the imports minus exports. And for most country, net exports tends to be negative for some items, positive for others. And you want to have a net total number of exports that is positive for countries. And that is good, a healthy economy for any country, right? What's happened when people are impacted? What happens to your buying and spending habits when things like this happen, right? It goes back to what Philip was saying. Confidence spending, it was high at the beginning of the year. Consumers' confidence was high at the beginning of the year. You look at people right now, not so high right now, because everybody's just like saying, am I even going to be, should I even go out and buy groceries? Because I need groceries now. And even going out to what used to be a weekly trip, now you have to really plan and prepare before you even step out the door, right? So this is going down. Government spending, is it going up or down? I think for the most part, government spending has been pretty much the same. And a lot of it has been utilized for something different, not for preparing for this type of event. And here's additional things that I think I want at this point. Philip, can you share your screen and then show us the GDP by country and also your portal, so we can actually demo yours now. I'm going to stop sharing and then you can share.
All right. Do you see?
I see it. Yes.
What do you see? Okay. Do you see our dashboard?
Yes.
Okay. Perfect. Do you want to start here? Or do you want me to talk through it?
You can walk us through what the data is telling us.
Okay, sure. Well, let's look at the U.S. as a whole. So this is a series of dashboards that my team put together using a combination of data from Johns Hopkins, World Health Organization, and the CDC data, including some of the other global CDC data that's available. The biggest problem here is finding good data and cleaning the data. So that was kind of a fun job. But we thought it was worth it. We came up with this, quick backstory is, with all that misinformation, we're seeing these numbers. People were publishing dashboards. People were publishing information as facts. Mm-hmm. And a quick Google search would say, no, that's not right. That's not right. This is either exaggerated or it's off by a lot. It's reporting smaller than it really is. So we said, hey, let's just build, I have my own personal beliefs, but let's build a dashboard that just shows the numbers. Like let the numbers be what they are. We're not going to put any bias into it.
Mm-hmm.
So looking at the U.S. numbers here, and this is the data is as recent as, I believe this is, April 1st, Wednesday. The Thursday data should be available sometime between now and the next hour. So Johns Hopkins has a feed, and we have to get a series of data and aggregate it, and not all the data is in yet. So looking, you can see the U.S. numbers here. We can see the growth rate overall. So we can see from really January 23rd, January 22nd being the first date things were really being reported. One case. Things didn't really escalate. Even 500 cases shows up as just a blip here on March 9th. So things have really escalated in the last 2 to 3 weeks, especially with the number of cases, the number of deaths really only being at 4,700, 4,739. I say it's only. Other people might say that's too many. I'm not really here to debate that, but just showing what the numbers are. We showed the recovery on a different plane here, just because it kind of got muted in the other data, since the number of cases is so large.
Mm-hmm.
As you can see, we show kind of the top 5 states here.
Mm-hmm.
You're seeing New York being, if you want to call them, leader. They have the most cases, 83,948, with the number of deaths. If I can get it to hover, because it's so small here, the number of deaths being about just under 1,400. What we did over here on the right side is we actually have a 1-week projection.
Mm-hmm.
And you'll even see this on the global level, but it looks like at first glance, we've been monitoring our data on a daily basis, and I'm looking off to the side because I'm running this on multiple monitors here.
Yes.
It looks like things are, at first, like about a week ago, I was looking at this and I said, wow, are we starting to flatten the curve? Nobody's talking about this yet. Let's monitor this on a daily basis. And what I find is that the projected numbers, and you can see it's where things kind of shoot off kind of at a, roughly a 45-degree angle, a little steeper. But what I found, though, is that on a day-to-day basis, this green curve is still increasing. Mm-hmm. And really what that is doing is what's thrown is the large number here. If you see all the way from the left over to the right, the large number of fairly small data, right, from 1 scaling up to 6,000, really kind of shows this false sense of security and flattening the curve. So that's something that we're looking at, is how to better forecast pandemic and viral information versus because this is different than normal data. Just interestingly enough, we looked at DMV. That's where we lived. That's where we wanted to start. What are things looking like in the DMV here? Obviously Maryland's got us, and they always did. Although we are kind of catching them, if I can kind of phrase it that way. The biggest thing to note here, you can kind of see. We put together a map. You see the size difference of the different number of cases. And also here on the timeline, you can see the rate at which they've grown, and DC seems to be doing something where they're not growing as quickly, and that could be based on different things, size of population. I really suspect it's the fact that nobody's working in DC, because they're right there with Maryland and Virginia. It's not like they're isolated. So I think it's the fact that everybody went home, right? But what I found actually the most interesting is this the chart in the bottom middle here that's got the big purple section. We wanted to kind of compare this to New York. Said, hey, what's the DMV looking like compared to New York? New York has really blown it out of the water. I mean, they're growing quickly, and the fear was that the DMV is going to be the next New York, right? That's I don't know if that's a good thing in any way, really, but one thing to note is that earlier in the week when we put together this wheel here, the wheel was almost fully closed. It was almost all purple. In fact, you couldn't see what color these other lines were. The greenish, the gray, and the blue. You really couldn't tell what color they were, and it was really hard to get things to hover because it was such a tiny little sliver. I mean, New York had almost the entire pie there. And within the case of just about 4 or 5, 4 days, maybe even 3, this wheel is kind of starting to open up, and the DMVs is starting to take a bigger chunk, meaning that it's growing at a faster rate than New York is growing. And that's definitely, definitely alarming. We live here. I don't know if it's, I would throw it out there that it's not really a surprise. Just like everybody else is going to shoot up, eventually they're going to level off. I don't know if New York's in the leveling off phase yet, but we are a little bit behind New York in the growth. So I definitely think that we could expect to see a growth rate that New York did see just recently.
So you were saying that it was almost all purple at the beginning of last week?
No, at the beginning of this week.
Ah, okay. So let me ask a question to the audience, because what I'm thinking is right now a lockdown here in US is like, it's a soft lockdown because it's like a self lockdown. And, to me, it's like, I know what I would do, right? They tell me, hey, this place is getting, full of these confirmed cases and we're on self lockdown mode. What do I do? Well, if I have a friend in Ohio, I just drive to Ohio, or have family in Ohio, I go to Ohio and I stay in Ohio because Ohio doesn't have that many reported cases, right? So my question to you guys that have been going around in the DMV area, how many of you have seen a lot more New York plates driving around here in the DMV area than before?
Yeah,
just type in
to see people's responses here.
Yeah, I want to see if you guys have been, going out for the grocery stores or whatever. Have you noticed a lot more not Virginia, not DC plates, not Maryland plates, which are typical? Have you seen PA or New Jersey or New York plates here in the area? Because that could be an explanation as to why those numbers are surging here in the area, right? If you guys can type in via the chat window, will be great, or the QA if you guys are seeing this kind of things, or tell me that you haven't noticed anything at all.
Yeah, it's funny that you say that because the other night somebody was driving in a way that was really annoying. Let's just put it that way. And when I finally was able to get around them, they had I forget the name of the state now, but they did have out of state plates. I didn't really think much of it. But my wife called me on the phone today and said, as they're walking through the neighborhood, she noticed there's a lot more New York plates. So to your point, looks like, they were no longer welcome in Florida and now they're here.
Yep. And so, some of you are saying that you have not noticed more out-of-state plates. I would be noticing that right now because, usually you see PA plates, some of that because PA is just north of Montgomery County. Maryland. And that's, sometimes you see, people that are from Texas and you automatically know that they didn't necessarily drive all the way from Texas. It just happened to be new transplants, or California plates, for example, from all the way across. But there's a lot of traffic and, it's driving distance. I've done meetings where, I've had meetings in New York or New Jersey in the middle of the day. And what I do is I just normally will drive early morning to get there, do my meeting, and then come back before rush hour, right? It's totally doable on a vehicle and you don't even have to fill up, right? Distance here is very, it's not like living in Texas. Living in Texas, you try to drive from Houston to El Paso. It's like, it takes you the whole day and you're in the middle of nowhere. Here is everything is so close together, and it's very easy for people to just kind of, basically go and travel even like a few hours, and you're in a different state. And I think that's likely to happen now, even in this lockdown mode, especially as the numbers you're seeing, everything is focused on New York, and very few people are actually looking at how many of those have already gone to either to PA or further towards the Midwest or just straight south, where in areas where there's not as many confirmed cases and the focus is not, the media is not focused in that area. So I think that's a real issue of trying to impose these, soft rules that have no enforcement and no one is doing the enforcement. I think it's a real issue because it's going to happen, right?
You know, one of the
Now,
things too on to that point is I have family member and friends that are police officers in multiple states, and
mhm,
across the board, you know, my friends and family that I've talked to have said that they're under orders to basically stand down. So they're not to stop and question people to find out where they're going, or you know, even the police have reported that there's certain situations that they're not coming to your house for anymore. You know, you can find this
mhm,
even in Virginia and in other states. So, you know, if there's some domestic disturbance, for example, they're not coming over unless somebody's been injured. So
yep,
they're really stepping down what they're interacting with people, what type of situations.
yep, yep. I hear you, and I think that all of these things. I mean, people are people, and we need to make sure that there's as you put enforce, and it's hard to say because I mean it's hard to really imagine this, but if you don't impose anything short of like martial law, where you actually have enforcement, somebody actively going around making sure that people are staying home and not doing things that they shouldn't be doing, or they're not traveling from one, state to another or across county boundaries, it's going to be tough to enforce. And, my point is that the reason why South Korea and China were successful in in stopping the spread is because they actually did that. And that's exactly what they did. As soon as they started testing everybody, they would then isolate people, and they would actually put them in physical barriers that people couldn't get in and out, and they could only be with people who were already infected, and then place those people who were infected, still take care of them, make sure that they had services available. If they didn't show any symptoms, they still could eat and sleep and do all those things that you need to do, but you could not then go with the rest of the population. And anything short of that, I think is going to be really, really hard. It's going to be a completely different change of mindset for US citizens to be able to accept that. And I'm thinking that because of that, we're going to continue to get this curve. It's going to be a long road where we're still going to be like this, and we're not going to be able to take that inflection point because no one is, has the leadership to say, let's do it right. And I just don't see any other choice. I mean, what's the other choice is provide personal protection equipment that includes gloves and N95 masks to the entire population before they go out the door. And right now, there's a shortage on that just for the healthcare workers, right? What's happening right now in New York is people are having to use gloves, 2 or 3 times, and the masks, reuse them when they're supposed to be disposable. And the healthcare workers are getting sick themselves. And often they're also running out of personal protection equipment, and that's why they're getting infected as well.
You know,
And
that's
it's
actually
a
really good.
it's a real crisis.
That's a great point. You know, even in the office space that I work in, there's been a lot of corporations that are, for example, I'll use GameStop as an example because I read about them this week. That they're one of the many who are publishing what their sanitizing practices are in order to make sure the public is comfortable coming. This is before we had the governor shut everything down, right? So they talked about, here's our policies, we're wiping all these things down, et cetera. Hand sanitizers, wipes, when customers leave, we wipe things down. And the actual local stores were reporting, hey, this isn't true. Yes, corporate is telling you guys that this is what our policy is, but they haven't supplied us with the cleaning supplies to actually do this. And when the local manager goes to buy them at Giant or Safeway, there's nothing available. So yes, that's policy, but they have no way to actually do it. And in my own office, I've actually witnessed the cleaning crew coming through at night, and I put this on them because as they walk down the row of tables, they have a little rag, and the lady just wipes the spot, takes a few steps, wipes the spot. So it's number one, supplies, and number two, just people being lazy.
Well, and even then, I mean, have you tried? I'm the say, okay, if people are not doing it, then I'll do it myself. But then I have to then you have to carry Clorox wipes and Lysol spray and wear gloves and masks. And let me ask a question to the audience: how easy is it for you to get access to all those disinfectants that work, and the gloves and the masks? you can't find them, right? You try to order them from anywhere, even Amazon or other websites. There's not enough right now to go around and provide this to the entire country in the meantime, to be able to, kind of protect yourself, even as you are engaging with other people who may or may not be infected, even though they're not showing symptoms. So I think this is going to be a tough situation to solve. And, short of giving everybody plenty of personal protection equipment to be wearing in the meantime, I think that physical distance is the best approach. And that by default means that some businesses are going to be impacted, and others need to persevere for as long as possible until we get over this mess. Did you have anything else that you wanted to show, Philip? I wasn't really sure.
Yeah, just one more page, really. I think, well, one or two more quickly. This is a global view. And, while we were talking about 15, maybe 20 minutes ago, I got an update, I think, through Twitter, my phone is. So this data as of the end of April 1st. So we'll have new data here shortly. Again, we're limited at how often we could refresh. So this data is, again, it'll be refreshed in probably the next hour, I'm sure. But let's assume that this is still just about right. We put together a heat map because this shows while America's getting, U.S. is getting blasted. It drives me nuts. In my opinion, the number of, if we weren't being recorded, I'd probably just say idiots. But since we are being recorded, I would just say people with Wait, are we? Oh no, I said it out loud. But the point is, if you look at the heat map, there's a lot of other information. You can't just take a number and make a judgment based on a number, right? I mean, if anybody did that, banks don't do that. Nobody just looks at one number. So we look at the North America, you see the heat map, while we are ahead, Europe over here looks a lot worse. If this was one country, they would clearly be ahead, right? But you take into account, Spain, you take into account Italy, when you zoom in here, it gets a little bit less hot. Looking from the distance, all these countries in close combination add up to that. That's a lot hotter than North America. So these are the global, numbers here. The total number of deaths. We included the growth rate, the death rate per cases on a global level, and then just a few other information. It was projected to hit 1 million on April 3rd is initially when we were projected to hit it. It looks like we hit it a day early.
Wow. So this is actually still accelerating, is what you're telling us, compared to your model.
Right. Exactly.
Wow. Yeah. So this is why I think we're looking now at how to mitigate the economic impact.
Well, so there's one country I want to focus on is China got hammered, and they kind of deserve it. Maybe, I mean, they gave it to us, but it's not really fair to say. I would say that it's half a joke, half true, right? I mean, things could start in other countries too. They has to start somewhere, right? I mean, right. The next one may start in the U.S.
Yes.
So I'm not trying to be unfair to China. It could start anywhere. But I wanted to look at India because India is really behind us. And as we were talking about, India has the second largest population. And I guess I got to find them. I don't know my alphabet very well. But the point is here they have a lot less number of cases here. But if you look at their growth curve, the growth curve is steep. And if this is something you're going to talk about, if you're going to talk about India in a little bit, I won't delve into it much. But on a global level, I think some of the next big numbers are really going to come from India.
Yeah, and I think that right now what you're seeing is the same effect that we had at the beginning of the year, and that is the fact that India may not, they've been in the same boat as we are, maybe even worse. They just don't have enough test kits to go out and sample the entire population. And that's why you're not seeing those numbers grow that much. I mean, these are only the ones that are confirmed, and confirmed, you're already undersampling because you don't have enough test kits to sample your entire population. And I think that this is going to continue growing. And I think it may be worse because India is densely populated.
So
And
one
do you
thing,
have the,
if I can jump in just real quick, and I'll try not to interrupt you again, 'cause, it's rude, but our page just refreshed. So now we are at over 1 million cases. This is the latest, greatest.
oh my God, so this is like real time. Is this available to all of us, this link where we can view this? Is it publicly available?
I thought about doing that, but honestly, there's a cost for us, and it's like if I give it for free, then I don't know. It's,
Oh, okay,
but
okay, got it.
I am honestly trying to figure out a way to actually do it. So give me a couple of days. We are trying to figure out a way to actually make this available
Yes.
in such a manner, because this is something we're doing kind of for free, and that's fine. But I want to figure out a way to make it public for people in a way that we don't break any license agreements, but it also doesn't incur a big cost for us.
Got it.
So now
Can you talk a little bit about on the back end? What is it that you're using to have this portal available that is responsive like this?
Sure. What we're actually using, so it's a combination of tools, and just I'll get to that in 1 second. India, just a moment ago, we were looking at 1,998 cases, and now today they have 2,543.
So they're on exponential growth.
They jumped up about 600 in 1 day.
Yep.
Yeah, they are on exponential growth. That's absolutely right. But no, to get back to this, so what we're using here is you can see, you'll probably see on the dashboard, that's Power BI. But what we have is, first of all, we found some legitimate data sources through, again, Johns Hopkins, World Health Organization, some of the other countries, for example, Korea, China, their CDCs, grabbing that data. And now the caveat is these are confirmed cases as being reported by the countries, right? Mm-hmm. So the numbers, and I know a lot of people, well, the numbers are way bigger. I 100% agree the numbers are bigger than we're reporting on due to people not being tested, possibly countries not properly reporting, but we're reporting on everything that is being reported. And so what we have is a data aggregation system, a way to actually cleanse the data because it comes in a couple different formats, and then a way to then update Power BI on a fairly real-time basis.
Got it. Thank you. Thank you for describing that. And let us know if the audience, if you have the chat window or Q&A, if you're interested in actually getting access to this type of portal. I think this will help Philip figuring out, whether or not he needs to move on this. If you're interested in having access and share it with family, even if they're not in this country, let us know, because we can then figure out how to make it happen. So just let us know. And let me move on. What I want to do is actually head back to my presentation. So let me start sharing my presentation again.
And Hector, while you're pulling up your screen here, I'm looking at the U.S. map with the new data. The
Yes.
projections are slightly more positive. I will say that the curve of the live data is slightly less steep, and you can't really read too much into 1 day. Mm-hmm. But I will say that the increase is looking less steep, which
Okay.
If this holds to be true, is definitely good news.
This is good news. We just need to make sure that it's consistently done across the entire country. Right. I think. Absolutely. So here's what McKinsey's saying, right? That even at 8%, which is actually the scenario 8.3, they did 9 different scenarios. You can actually read the report because that'll be accessible to you all. But out of the scenarios, one is kind of like the middle case that we talked about out of the 3. So we're not going to be quick recovery, right? We're not. But we are going to be doing either a recession or a global recession. And this is what it means. A recession, just an economic recession, meaning it happens only to us and not the rest of the world. We're going to be here. You compare the minus 8% and the minus 13%, and you look at all the way through the Great Depression, which is what this is right here in the 1930s. And then this little dip, guess what this is? This is the Great Depression. What is this dip? Because only this dip is the only thing like what's about to happen according to McKinsey. This dip that went down to about almost minus 15% of real GDP drop is World War II. This is the impact of World War II in the U.S. economy. And what this is already at, as projected right now by McKinsey, this is already at the same magnitude economic impact to US as World War II, and it may actually get worse. So we're looking at not the same as the Great Depression, but definitely much bigger than the Great Recession, because this is the 2007 Great Recession, and this is where we're at right now. So even the best case scenario, this is going to be a deeper recession than the one we had in 2007, and this is the worst case scenario so far that's being estimated. And this numbers are all current as of March 25th, based on information McKinsey is right now publishing on a weekly basis, looking at the impact. It's like saying, trying to sharpen the saw as to how to forecast for anybody who's a McKinsey client. So let's talk about now recovery, right? What is it that you can do, and what does it mean for countries? So earlier, the World Health Organization actually talked about 6 steps that each country must take in order to figure out how to get ahead of this curve and not be in the situation, basically do the same thing that China and South Korea have done. Because right now, so far, they've had the best response and the best turnaround plan to actually get the numbers back into manageable numbers that don't overburden their healthcare system. And this is what they're saying. Number one, you have to expand and train and deploy your health workers. Your entire health workers have to be repurposed, because now we need more respiratory specialists. We need more practitioners that can treat people who are not critically ill, even though they're not ENTs or pulmonologists or whatever specialty you need for critical, because the specialists need to focus on the critically ill only, and the rest of people that get sick can be dealt by other practitioners, right? And you have to train them. You have to train them, because if they haven't done this before, they have to get smarter as to how to recognize, confirm, and detect and then isolate cases. Then number 2, you have to implement a system to find every suspected case, and that is test until you know that you have a good handle on the number of new cases. Then ramp up your test capacity and availability, and then be able to adopt key facilities so that you can create more ICU rooms when you only have a certain limited number, and you need to kind of bring it up at least to deal with critically ill. Even if you're flattening the curve, we will need to redeploy these facilities. Then have a clear plan for how to quarantine people, right? And quarantine is when I say you're putting them behind physical barriers so that they can't get in and out, to keep those people who are infected, that are not necessarily critically ill, but infected, at least quarantined long enough so that they can go back into the general population. That's number 5. And then number 6 is what everybody has been focusing on. We want a new therapeutic now. We want a new vaccine now. And all the experts are saying is number 6 is 18 months away. There's no silver bullet on how to solve this, right? Therapeutics and vaccines are about 18 months away, no matter who you talk to that is an experienced person that has done this before. And why is that? Because the virus that causes COVID-19 is a completely new type of coronavirus. Yes, there are known coronaviruses that we've dealt with and have vaccines and therapeutics. This new one is the coronavirus for which all those therapeutics, all those vaccines don't work. And furthermore, our immune system, our bodies have zero immunity to this virus. So that's where things are at. And some of us don't show any symptoms. We can be infecting, others can get critically ill, and others may actually not make it, if they do get sick based on their reaction to the virus. 3 steps that U.S. could take is to, number 1, have a consistent nationwide approach to the shutdown, not a free-for-all that New York State does something, California does something else, and then other states don't do anything at all. Because right now there's states here in the U.S. that is business as usual, right? Not the right approach. Federal government needs to step up on testing and also have a data-based approach. And actually, this is what we attempted to do. And then we were talking, Philip, saying, hey, can we use this information to kind of lead people that are interested in developing therapeutics and people who are interested in developing vaccines, or even figure out how many more test kits to develop, because we need more than 300 million test kits if we're going to be sampling the population multiple times over time for a few months in order to bring this back into control. All of this is manufacturing that hasn't occurred before, and we need to ramp it up. And that is a positive step in the economy because it's a new type of productivity that we haven't had a need for this type of productivity before. And that means that it's an opportunity for current companies to either become heroes by stepping into something that they haven't done before. And, to be honest, there's great companies that are already stepping up. GM stepped up and says, we're going to help create more ventilators. Same as Ford, right? A lot of the automotive companies are stepping up. Tesla earlier this week announced that they actually bought excess ventilators that were FDA approved, being used in China, no longer needed in China, and they bought them brand new because they were purchased by China, never used. Tesla acquired all those ventilators. It's almost 2,000 ventilators, and today they announced that they're making it available for any hospital who needs them, and you can purchase them from them online, and they will ship to you for free. That's what Tesla's doing. So there's companies that are stepping up, even though this is not their market. But my question is, why are these companies, and why are we asking these companies to be doing things that they're not specialists at? Yes, we need that, but we also need, they're going to need lots of other help, and we need the federal government to step it up if we're going to go into taking a more offensive techniques to actually get ahead of the curve.
Actually, regarding help from feds, because we also have state level government.
Yes.
And I guess this gets a little bit political, so maybe we don't have to discuss. I'll throw it out there. There's no recourse, right? The state governments have a job to do. They didn't do their job, and now they're screaming for the feds to help. It's just like any leader in any company. To me, the governor is the leader of a state. You have a job to do. If you can't do it, then you got to find somebody who can.
Well, I think right now it's like, we're acting like the divided states of America, not the United States of America, right?
Very true. Yeah.
We need to start, this is changing our mindsets, because we need to collaborate, even though across industries, not just stick to our own swim lane that is our industry, right? This is what GM and Ford and Tesla are doing. They're automotive companies, and they're stepping in saying, we have the workers, we're willing to repurpose our manufacturing to actually be able to improve the capacity to these ventilators that are needed. But we need that not just for ventilators, we need that for protection equipment like gloves and respirators, as well as goggles. These are all things that we're going to need, not just for construction workers, because typically that's being used by construction workers. Now we need that for the entire population, at least to get, until we get a therapeutic or vaccine that works. And we know that's going to be at least 18 months, right? This could be creating a brand new industry, and as opposed to us offshoring, we need to create that industry in the country to get ahead of the curve. And if we were able to do it, I can guarantee that all those manufacturers of all this stuff that now we never used before, we can sell them to other countries where their wave is going to happen later after us, right? But nobody's talking about how to actually start creating these economic incentives for companies that are in certain industries to now step up the manufacturing in this sector that is needed, because now it's a new segment that is needed to actually address the needs of the country to move us forward this year. So all of these things are things that I think lessons learned is figuring out how to collaborate more, because it's not just one company. I think it's going to be all the people that have the right workers that can be very quickly repurposed, reuse, and reduce the waste and the time wasted in getting things done to step up production of all these things that are needed, where right now we can't buy them because everything is backorder, right?
One interesting thing too, I think, kind of taking this back into a business, I guess, perspective is, I was looking up to make sure I was right, but Sprint, didn't start out as a telecommunication company, right? They started out as a railroad company.
Yes, that's correct.
That's their origins. And what I kind of typed in the comments earlier is a lot of times companies under adversity, and even people under extreme situations, sometimes really find their true meaning or reinvent themselves. So I am really kind of curious what comes out of here. Companies that are either supplying medical devices or how businesses acquire medical devices, that may change in the future.
Yep. And actually, this is a great point because, what we talked about is here. This chart I want to talk about real quick. For certain industries, this is already a depression, right? Because look at the GDP lost for commercial aerospace and oil and gas. It's already at minus 45% at this point as of the printing of this date. These are U.S. companies in this industry. And you can tell that high tech, so if you're a software company, or even an analytics platform provider, even may have some impact, but that impact is much lower than these that are basically in the front line of what got hit. Because anything in hospitality that includes airlines, car rentals, even oil and gas. Because why is it oil and gas? Because who's the biggest consumer of gasoline, fuel? The airlines. Jet fuel is the number one revenue generator for oil and gas companies. Yes, we all drive cars, but that's not a significant consumption. The major industrial user of gasoline, jet fuel, and those are airlines. And then from there, everything goes down. Why is insurance down so much? And also banks? Well, how many of you have gone to the doctor now or have had to go to a doctor for some reason? So you're using more healthcare. Number two, for those people that do have life insurance, what is people that actually right now in New York, their life insurance companies are paying, and there's the more debts, the more they have to pay in the next few months, right? That's why insurance companies are losing money right now. Yes, we haven't changed insurance plans, but we're consuming because we're having to collect based on the type of insurance that we have, because this includes all types of insurance, including also business insurance. So if your business is suffering right now, chances are you're already putting a claim with your business insurance provider, and that's all this is why these are down, because everybody's going to be consuming their insurance because they're collecting and they're going to be filing claims, and those claims are going to have to be payable in the next few months. Same for banks. Banks, financial services is coming down. They're the next one because this is a pipeline, and this is like a domino effect, right? This is U.S. industries going in this direction. The longer it gets, the worse it gets, and then the worse it gets for everybody. It's going to be a funnel very similar to this. And these guys are already at the depression mode level. Not recession, depression. We're going to see a lot of consolidation of these companies in the next 2-3 years. A lot of consolidation of these companies. And that's the future. That's what this will tell you. Here's how to survive. I mentioned your company can be either a hero, a villain, or a zero. Zero means you're going away because you're going to go out of business, or you're going to go out on a fire sale, right? You don't want to be a zero. If you want to survive, and not only survive, but persevere, whatever environment you're in, no matter where you are in this industry, here are 7 steps to help you persevere through the downturn, the economic downturn, and then begin to thrive immediately upon beginning of recovery. That means you get back into positive GDP growth. Here's the 7 things. You can resolve to immediately put out the fire and maintain your business running. Do whatever you need to do to keep positive cash flow and be able to still keep essential workers employed. Inspire those leaders, those employees that are essential, inspire them so they can figure out how to collaborate on the supply side as well as on the demand side channels, and figure out how to improve the resilience of your business. to be able to then quickly, upon persevering, as soon as you see the economy recovering, then get back into scaling the business back to a new normal, because that's what it may be, a new normal. And then moving forward, as you start recovering, rethink your growth strategy, because your growth strategy should not just be about becoming more efficient. It should be also about building resilience so that you can persevere any black swan event. Black swan event is like a pandemic that nobody thought that it was going to happen, and it happened, and you can't react because it's an explosion, not a fire, it's an explosion, and you can't even go in to try to put out whatever collateral damage was near that. And it's now similar to a wide event that's going to be impacting lots of different companies for some time, and a lot of innovation needed to rethink what growth is going to be moving forward, and how do you continue to focus not just on efficiency of your company, but actually building the resilience of your company so that you can persevere any type of catastrophic event. So these are the things that I would recommend you do. And personally, what I would recommend that you do, if you're not a business owner, but you are wanting to figure out how to get involved and you want to step up, if you want to really make a difference in today's environment, people are needed that can actually do different kinds of jobs that are right now surging, right? There are companies that are surging. Amazon and Walmart and all those ones that have a delivery system, they need more people to be working at warehouses where they can package and fulfill orders and then put them on the truck. You also need people delivering from warehouse to distribution center to the home. These are all logistics that are needed, and Amazon.com is hiring right now. There's also a lot of logistics companies that need to do a lot of analytics, because logistics is probably going to surge across FedEx, UPS, DHL. All of those things are going to have to happen. And now they're going to have to install systems to make sure you're disinfecting everything in real time as packages come in from abroad, or even coming in from a different location. Just in case, now you're going to have to disinfect the packaging before you can actually handle it, right? These are all things, new opportunities that are being created. So a recession is not necessarily bad, right? Because opportunities go away, but new ones come up. As a business owner or even as a worker, you got to start looking at those new segments that are coming up and then offer your skill sets in the things where you can make a difference based on your knowledge, your expertise. And there's a lot of analytics expertise needed right now in the logistics industry and in the healthcare industry, and all of these ones that are right now being utilized more by the majority of our population. Philip, do you have any other thoughts about where else there's going to be growth in opportunities? Where else are you seeing new growth that was not expected because of what's happening right now?
Yeah, actually, I see a couple of things, and one came to my mind while you were talking about Amazon. If you look at what is Alibaba doing differently than Amazon, and it's their investment, at least as far as I understand, and if I'm wrong, correct me, their investment in autonomous delivery system. Mm-hmm. So having robots actually do the picking versus having, Amazon right now has humans walking. I know people that walk 10 miles a day through the Amazon warehouses, picking things up and putting them in boxes, which is a big risk, right? Now when you get a package delivered, does the package literally contain COVID-19? Mm-hmm. But another area that I've been investigating personally is so many companies were unprepared for the workforce to work from home. They didn't really have the infrastructure. And I've been looking to find is there a way that we can help for the future when people go back to work, or if, some companies may prefer a remote type environment. Now, I think, systems that enable that, whether it's, we're not really in the business of providing some of the different backbones that companies need. But one of the biggest challenges that I've known of personally is bosses who don't want their workforce to work from home because they're not really doing anything at work. So if they're not really doing much at work, what are they doing at home? Mm-hmm. And in fact, I talked to a guy that told me yesterday he spent the first 3 hours of his shift sleeping because there was nothing to do. So, I mean, if people think I'm making this stuff up, I'm not. So, systems to maybe help, management track, and some of these things exist, but how do you track, what people are doing? And I don't want to ramble, but the point is, I think that there really can be a lot of opportunities as people rethink this. And I think the biggest takeaway, Hector, is you and I really have been talking for 4 or 5 years now on digital transformation. In fact, digital transformation kind of became such a buzzword, I quit using it because it was overused. People didn't want to invest. They didn't want to spend the money because it won't happen to me, which was like what I always address in the first 5 minutes of my talk. But now it is happening to everybody. And I think people are really going to be open to more digital processes. And I think that that's going to be the next big win. Yep.
Agreed. And I think that that's something that you need to start looking for new opportunities and kind of reuse your skills in a different area that right now it's about to be surging. I think there's going to be a lot more augmented analytics needed in logistics, and that includes geospatial, but also adding other things as well, because we're going to have to get packages to and from faster, track them, and make sure that we know exactly where they're at, and whether or not they have been disinfected or not as they're coming in from one place to another. They don't have to necessarily be coming from abroad. They could be inside the country. And at least for the next few years, I think this is going to be a new normal, is to figure out how to, irradiate disinfect using UV systems, for example, to as you are doing packages where this particular virus can survive, 24 hours or longer often, right? All of these things are things that if we're going to start, continuing to, let's say, really change our behavior and buy more online, all these companies that are there available, they're getting flooded right now, and everything is on back order because of all these different back-end issues that they're going to need. Lots of automated systems that can track things and then give them dashboards where they can now look at what's going on, and that's just for operations. And the other thing is that there's an assessment that Beyond developed, and if you're a business owner, you can actually take this. It's a free assessment. You can actually follow the link here and get your score. We call it a thrivability score. We're going to make this deck available. This is the also hyperlinks. There's actually a virtual conference that happened at the middle of the month that talks about everything. This is actually, they got the bright minds, epidemiologists and doctors talking about their perspective about why this is so important to do. And what we're seeing right now is reality. This is a new normal, and this is going to be a long-term impact, what happens afterwards. And yes, we are going to get out of all this. It just means that it's going to be a new normal. And
yeah, absolutely.
Gartner also published their own, if you're a CIO and have workers, on how to respond, manage, and prepare for a new type of event that you hadn't before. Even if you're an IT company or a software company, this is great information. It's actually a recorded webinar that has lots of information, very useful information. If you're looking to get more information, go ahead.
Oh, before you close out, one of the things I'd like to ask, and whether this is through the chat or just messaging directly, I would love to get feedback. We demoed our dashboards that we put together. I would love to get 100% honest feedback from people, like what they thought of it, how it could be improved, if they liked it or not. I'm not looking for any, I'm not asking for a compliment. Really, what I would love to know how to improve it, or if it's awesome, I'd like to know that too.
Perfect. And this is, you can actually get a hold of Philip. This is his email, the website, and also his company Twitter. My email and also my LinkedIn profile is short URL, and then my handle on Twitter. And also, if you are interested in figuring out if you have a business, whether it's a SaaS business or a platform business, and you're trying to figure out how to persevere the current economic situation we're in, you feel free to schedule a call with me, and you can send an email to hector@beyondma.com with the subject line Thrive, and we can actually, I can follow up and set up a free call to kind of talk about your current situation and maybe identify how we can help you. So with that, I don't know if you guys have any other questions. I've been monitoring the Q&A, but I see a lot of comments, not necessarily a lot of questions. And I know that so if you have any questions, go ahead and type them in and let us know. Right now, we're looking at continuing to do a virtual and open to ideas as to what else is new. I hope this has been useful for all of you. And if you want to, we can share this video with anyone that wants to have access to the information. We're going to put everything on a landing page, and I'll send you the link to that as a follow-up later this week. So let us know if there's anything else. But other than that, I really want to thank Philip for making himself available. And also, Philip, thanks for all the work you've done and putting this so quickly from the time we started at the beginning of the month with all these discussions. And, I'll let you know also if I get any feedback. I saw at least one comment on somebody who was interested in actually getting more information about it, about your portal in the chat window. So we can actually follow up also offline. But also, if they don't get a hold of you via email, at least we have some of the people that responded via the chat window as well.
Great. Hey, and by the way, I know you're leading it, so you're giving the thanks, but thank you. I know you put together a lot of research to get these numbers, and I know it's not easy because you did a lot more research than I did, and I know how hard I work. So thank you for all the work you do putting this together.
Yeah, no, it's my pleasure. I mean, right now, I can tell you that I've got some people, I got family that are healthcare workers, doctors and nurses, and not just here in the US, but also in other parts of the world. And this is happening, not just here, it's happening everywhere. And, for me, it's been, my interest is that I want to make sure that at least I know how to give the right advice to my family, my extended family that are all in the front line of being healthcare workers. And I know on your side, you have people who are police officers as well, right?
Right.
And these are all people that are in the front line, and firefighters, police, any first responder, and then healthcare workers. Right now, they're on the front line of this.
Yeah.
All right. Well, thank you so much and have a great evening. Be safe and be blessed.